Thank you so much. I'm Lily Farhang. I work at Human Impact Partners, and I'm really happy to see all of you here. I'm just curious, was anyone at the Democracy and Health session yesterday? Were you there? Did you love how at the very end they brought up Citizens United, and like that was the way they talked about corporate power? And I was like, oh, come to our panel. You're going to learn a whole new way that corporate power affects health beyond elections. So I'm really glad that you're here. So we rearranged the order of our panel to have it make a little bit more sense. So bear with us. I hope that's okay. I think it'll kind of build on each other in a way that I think folks will appreciate if you're able to stay for the whole time. And I apologize if you came to just check out one session and it's not exactly when you expected it. So I'm both a moderator and a speaker. So I'm going to kick us off. I'm going to offer a few framing remarks. I have a bunch of notes I'm going to look at, so forgive me for looking at my notes. So I'm going to offer a few opening kind of points, and then I'll introduce our panel. Hey, Sophie. There's seats up front if you want. Yeah. And then they'll dig in sort of into examples and the content that we're really excited to talk about here at APHA. Unfortunately, I forgot to include my no disclosures to report slide, but we're not taking any money to do this. So just a teeny bit about Human Impact Partners. I'm one of our two co-directors. We're based in the Bay Area of California, but we work nationally, and we are basically a public health, social justice nonprofit that is trying to transform the field of public health to center equity, and also trying to support grassroots community power building movements to achieve social change. And we have this two-part of our mission. Hey, Marianne, come on in. It's like family. Most of the work that we'll talk about today kind of lives in our policy and organizing house, what we call it. And the way that we're organized, we do a bunch of direct advocacy, policy analysis, research to try to influence specific social determinants. So specifically housing justice, economic justice and worker power, climate justice, and abolition. And then we have our bridging partnership. And then let me actually say, then we have our capacity building team, which focuses on supporting governmental public health to change systems, policies, practices to integrate racial equity and power sharing with communities. And then we have our bridging team, which basically tries to bridge governmental public health and grassroots community power building organizations. So that's what HIP is all about. And the reason really for this talk today is to try to lift up a through line in our policy and organizing work. What we've learned over the years of working on climate justice, worker justice, housing justice, is there's this thread across all of those areas that relates to corporate power and that relates to the role that corporations basically play in these spheres that influence health. And so it's not enough to only talk about shifting government policy. Come on in, there's a few seats up in the front, welcome. It's not enough to only focus on targeting government policy, but actually we have to directly and explicitly target the practices of corporate actors because they have an enormous influence on our lives in ways that is different than it used to be. And so I think public health has to up its game in thinking about who are we targeting. It's not just about targeting elected officials and government leaders and agencies. Okay, so before, like I said, I dive into before our panel kind of comes up here, I just want to frame up this connection between corporate power and health. And we do in public health have kind of a history of targeting corporate actors. You can think of big tobacco and sugar sweetened beverage industry. Like, it is in our field's DNA, right? We have sort of said, like, okay, there are certain direct contributors to poor health that we have decided we're going to go on the offense with. And I would argue that the involvement of public health or the leadership of public health in targeting big tobacco was highly successful. Of course, they shapeshift in response, and so there's been lots of ways in which the things that we targeted in the 90s and 2000s and through the Master Settlement Agreement, were successful, but then, there's things change, like what's it called? Like e-cigarettes is something we did not plan for. And so now we're back on, defense and trying to figure that out. But so what I want to kind of highlight is that we do have this history of targeting corporate actors. They have typically been for when those actors have direct and immediate impacts on health and health inequities or health disparities. And what I think we're trying to argue for is that if we as a field care about social determinants of health, and we know that those, or whatever CHR&R says, or the Wisconsin Population Health Institute's data says, it's like if that's like 60 or 70% of what determines health status, then we really need to be thinking about targeting corporate actors at social determinants as well. Okay, so we're, HIP is not like just out there on its own, kind of pushing this today. The WHO recently came out with this report in 2023 that talks about the commercial determinants of health, and that their framework is for conditions, actions, and omissions by commercial actors that affect health. And so I think the value of the WHO report is it's validating, right? It gives us some sort of like wider authority that we can lean on for work that we're trying to do to influence things like housing and working conditions and climate change. And that terrain is heavily influenced by corporations, not just governments, as I said. And so there's Jamila Mishner who I have never met, but read a piece that she wrote a couple of years ago. It's a framework that she published that talks about, health justice through the lens of power. And what I really appreciate is this idea. Come on in, there's a couple seats up front. Welcome, welcome. She talks appropriately about building community power as the avenue to affect social change, but also the importance of breaking kind of bad power, right? So all power is not bad. We need power, communities need power, advocates need power to be able to win and affect social change. And we want to make sure that those that have a stranglehold on power to serve their own interests and their own needs, that don't advance community interests, that don't alleviate inequities, we want to break that power. Like, I'll be really explicit about that. And so some of the examples that we're going to talk about today, I think, are in that model of how do we actually break corporate power. And so we have a super long way to go, but I think public health has done a lot to be thinking about the building community power aspect, and we actually have a session from 2:30 to 4 if you're interested in learning some examples about how public health can help build community power. Come check that out. But we have much farther to go in this breaking the power of those who profit from health inequities, especially in areas outside our traditional public health practice. I'm going to just run through these 4 reasons why breaking corporate power is essential, like today. And so the first is that corporations just wield tremendous power over our health through the targeting of harmful products, through climate and environmental destruction, through unsafe work environments, through distorting the truth, like around climate change or tobacco, and through limiting affordable access to medicines. And so we've at HIP have done a lot of research on those pathways ourselves, and there's a few others that we think are important to look at, including how, in particular, kind of around working conditions, and we'll hear a little bit about how the lack of paid sick days and benefits at places like Walmart have enormous impacts for their workers. They are the largest employer, right, in the United States, in the world? In the world. Okay, thank you. There's backbreaking working conditions at places like Amazon that we've looked at. And then there's, sort of growing issues with the intersection of climate justice and worker justice when you think about the threats that a lot of frontline workers are basically managing. Like, think of farm workers in California during fire season. And so, so that's sort of it's like they have a tremendous impact on our lives. There's really no question about that. The second reason is that they are increasing their reach, market share, and speculation on human needs. And so they are they are increasingly commodifying aspects of our lives that were not previously seen as market opportunities. Suk is going to talk about research that HIP recently completed about Wall Street's growing speculation on rental homes, which has increased since the foreclosure crisis. We're also seeing similar patterns in other industries where investors, in particular private equity, are speculating on healthcare, on public infrastructure like water, and on our environment. And private equity is especially dangerous because they promise profits very quickly. Like the whole model is, we're gonna gut this thing that we are investing in to make and extract as much money as humanly possible, and then we are going to abandon that thing to its own devices. And so, there are high costs that come from both the slashing of costs and then often the workforce that loses their jobs basically when private equity leaves. And then the last area is, the last thing sort of related to this increasing their reach has to do with personal data and surveillance systems. So Shoshana Zuboff wrote The Age of Surveillance Capitalism, which talks about how big tech companies have monetized personal data to predict and control behavior, erode our autonomy. And so it raises deep public health concerns because it shapes our access to information and the narratives that define well-being. Sorry, no, I'm the one that's actually running late. So third reason, they use their power to shape markets and public understanding to serve their purposes. And so they, these corporations, they're thinking about how can we shape regulations to be in our favor. Industries like tobacco, fossil fuels, tech, they kind of, they control a particular narrative that they are then able to kind of codify through the regulatory or administrative state. We have a history of combating this kind of disinformation, but I don't think we're great. I just don't think we've evolved beyond really tobacco and kind of the Marlboro Man imagery. And so there's like some info here like from the Justice Department that talks about cities around the country who recently sued this technology company RealPage, alleging that their pricing software has allowed landlords to illegally collude to fix rents far above what they otherwise should be. So, it's like, yeah. Okay. And then, obviously we know that corporations influence public institutions, including public health. And so this kind of entanglement really distorts the priorities of our public institutions, diverts resources towards more extractive processes. And I think if anybody saw kind of that recent data that was, reported in the New York Times, that I think it came from a New York Times Siena poll that basically said like 75% of people do not trust government. And of course, my reasons for that are this. The right wing's reasons for that are different. And I think we have to walk a really interesting line, those of us in public health, where we can somehow talk about the collusion and not necessarily break the system. So someone had a quote yesterday where it's like, how do you bend government towards your will but not break government? And I think it's a very fine line for us in public health to walk and be thinking about, and it's incredibly complex, but we have to figure it out. I'm not gonna, Will will be fine if I don't read the evidence, right? Okay, great. There's a lot, there's so much here. And I think the one thing just to say is that there are a lot of efforts to combat the influence of corporations, even within public institutions. Like if you think of enforcement agencies, and we'll hear from Larry about that in a bit, but they're just understaffed, right? Like they don't have the resources because those resources have been diverted to other kind of sectors. And so there's a pylon of these harms effectively. And so, what's our call to action today? I think you won't be surprised. We have to think more about both building community power, come to the session at 2:30 to hear about that, and then listen to these ideas for how we can kind of break corporate power. I think I'm going to end here and come back to kind of these closing points around our call to action, kind of as we wind down the panel. And I'm going to introduce our panelists. Thank you for letting me run on. So we have Bianca Augustine from United for Respect, who's going to share about worker-led campaigns for economic justice, including those targeting some of the world's biggest corporations, and how health professionals can collaborate with these movements. Then we have Sukh Purewal Boprai from Human Impact Partners, who's going to share research on the health harms of corporate landlords. Larry Brooks from the Alameda County Healthy Homes Department will then dig into that more deeply, describing how to strengthen the regulatory and enforcement landscape for healthy housing. And then Tony Samara from Right to the City will talk about how public health can collaborate with housing justice movements more broadly to advance stability, affordability, equality, and create decommodified housing models beyond the reach. I'm going to have all them go, and then we'll open it up to questions. Yeah, we good? Awesome. Thank you. Bianca, we're going to chill at your seat. Yeah. Yeah. You good? Do you need me to advance slides for you or anything?
Yes. Or actually, I can do the clicker too. The clicker works.
Does this clicker work?
I don't know if it's plugged in because my flash drive isn't.
Oh, okay.
Yeah, the flash drive has.
I can chill right here and move your. Take it away, Bianca.
All right. Good morning, everyone. I'm Bianca Agustin. I'm the co-executive director of United for Respect. We're both a C4 and a C3, so it's United for Respect and United for Respect Education Fund. I'm originally from a small border town in Southern California called El Centro. But I now live in Albuquerque, New Mexico, which is the tribal homelands of the Tiwa Pueblos of Sandia and Isleta. I do want to acknowledge that before I begin. But I also want to thank Lily and Sukh and Human Impact Partners for all of the collaboration that they have done with United for Respect over the last few years and for inviting me to be here today. I joined United for Respect in November of 2019 after about 20 years working with the Service Employees International Union, organizing service sector workers up and down the East Coast and parts of the Southeast in the United States. I was sort of what we call the fly team. We just fly into places and live in a hotel and organize. But I wanted, and go to the next slide. I want to talk a little bit about our organization. I'm sure people are probably not super familiar with our work. So we're a national nonprofit that focuses on raising standards in the retail industry. And we do that through developing the leadership of frontline retail workers to actually lead corporate accountability campaigns against what we call the biggest, baddest players in the industry, Amazon and Walmart primarily, but also you heard the word private equity in the housing. Private equity is also a predator in the retail sector. You know, they've gobbled up a number of well-known name brands that have ceased to exist. Toys R Us probably the most emblematic of those bankruptcies. And so we really take a twofold approach. It's both trying to wage campaigns on the ground inside of workplaces to get employers to voluntarily raise standards. That obviously has its limitations because it's voluntary. And so the other part of what we do is public policy work at every level of government, although in the last 5 years I'd say we've stopped focusing so much at the federal level and put a lot of our resources into city and state level policy change. And really our focus there is very broad. Because we agree with the analysis in the abstract that I think a lot of you read for this agenda, which is that work impacts all aspects of health for workers. And so you'll see our organization involved in coalitions that may seemingly not seem like a worker-focused coalition, but it's near and dear to retail workers' hearts and well-being. And so we originally started this, for those of you who want some little history, we originally started as a project of the United Food and Commercial Workers called Our Walmart. You might have remembered those early 2000 strikes happening. That was actually done when we were part of United Food and Commercial Workers. We became an independent organization in 2015. Next slide.
Bianca, I'm wondering, these folks can't see
Okay, I
you
can stand
behind
up.
here, or if you want to switch with Sukh, it's up to you. Yeah.
I'm switching.
Is that okay? Is that a little better for folks? Okay.
And the
sorry.
dress was
just
not meant
this.
to match my slides, but it does work. I just realized that. Color coordination.
Okay, sorry. It was just the podium was blocking you. Okay.
And so just a little bit more, so we focus on retail for 4 primary reasons. One, it's an economic powerhouse in this country. It represents 6% of GDP. The retail industry employs 16 million people directly, millions more indirectly through affiliated industries and contracted work and temp work. The second reason is the industry is highly consolidated. 6 companies represent 40% of the entire U.S. retail market. Primarily Amazon and Walmart represent half of them. So you can see their market power. This is why we focus on them. And then retail workers are disproportionately BIPOC and women. And the retail work is unfortunately still largely non-union, low wage and low standard. You can see the wages there that I put. I mean, you're hovering at $14 to $15 an hour, which in any part of the country is a poverty wage. And so we see this, you know, I think we'll probably agree with this framing and this infuriating reality as an opportunity to organize and activate the people who are directly impacted by the retail industry's abuses and largesse, to actually lead the fight against wealth inequality, racial capitalism, and corporate corruption. You know, retail industry, especially Walmart, there's lots of studies about Walmart's impact on setting market average wages in every city. They're the #1 employer in, and they're the #1 employer in 22 of our states. And so they really have an impact on setting low standards. And so that's why we target them. So we go to the next slide. And so our motto, I mean, we have this crazy, big, bold vision. Obviously, we have to have an approach that doesn't just include us. But the core of our model is the base building. You know, that is direct worker organizing. And for us, that's both happening on the ground and online. We have organizers in Georgia, Michigan, and California currently. We plan to expand that worker organizing, sort of boots on the ground organizing in Texas and probably North Carolina. The retail industry, particularly Walmart and Amazon, are highly concentrated in the southern United States, and average wages there are below that. So you see that $14.36 and that $15. That's not what they're paying in the South. They're paying less than that because they can. Minimum wages in most of the southern states are the federal minimum wage, so they're not breaking the law. You know, we also do corporate research. We like to track the industry. We like to track the players. What are they trying to do? What are their own opportunities? What are their own vulnerabilities? Can we get involved somehow? Can we muck it up somehow? We are very, very intentional about how we message about our work. We try very hard to center our member leader voices. Because we think that it's through them talking about what's really happening in their communities and in their workplaces that we can shift public perception about what Walmart and Amazon are actually doing in our society. But we are not naive. We are a small nonprofit. We have, I think, 19 staff. We know we can't beat these giants by ourselves. And so we spend a lot of our time building coalitions, building partnerships throughout what we call the movement ecosystem. HIP is a part of that movement ecosystem. And so we co-founded the Always Essential Coalition, the Athena Coalition, and the Private Equity Coalition, which at the time was hyper-focused on retail and climate, but now has expanded that coalition to focus on housing for obvious reasons. The industry is really taking over the housing stock in our country. And we believe in just building local partnerships. You know, we're invested in the communities we organize in. We've been 2 years now organizing in East Point, Georgia, which is just outside of Atlanta. And we now have a table of elected officials, progressive organizations, churches, who, you know, weren't willing to take on Amazon 2 years ago and have started to do that because they can sort of see a collective power starting to get built. And so next slide. Oh, you can just hold. So I was introduced to the work of HIP in 2021 when I was not the co-executive director. I was actually the corporate accountability director at the time. And given the moment we were in, I was hyper-focused on campaigns to win hazard pay, real paid sick leave, and I'll talk about why I said real, and PPE and other safety, it's appalling, super basic safety protections for retail workers during the pandemic. So HIP actually partnered with us and the Athena Coalition on a number of projects in support of Amazon workers over the last 3-4 years. But I'm going to focus the rest of my time talking about work that we've done together in support of Walmart Associates. So in 2020, there was a group of what we call a national committee, which is just Walmart workers from different parts of the country who meet with us on a weekly basis. And are plugged into different parts of our program. Some of them are directly organizing in their shop. Others of them are just part of our state policy work to pass their work week or to lift the wage. And so a group of them decided that they'd had enough. You know, this was about 8 months into the pandemic. Walmart, which we have a report on our website, but was very, very slow to respond, you know, after lobbying to stay open, to be considered essential infrastructure in the country. Very slow to provide safety measures inside of the stores. And so they started a national petition and then activity in workplaces demanding hazard pay, paid sick, and basic PPE, like literally hand sanitizer and masks. Walmart provided that for the first 3 months and then asked associates to bring them themselves. Which for a lot of people, I mean, it doesn't, you know, I think when you're making $14 an hour, that's a cost not everyone can bear. And it was just, you know, it was not acceptable. But I want you to hear from some of our leaders themselves. This was part of my time at Time Bit. So that you can sort of see sort of the emotional like commitment that they had to this fight.
It'll take a minute. Okay. So I have it on here, but it's not showing up on that screen. What happened to the screen? What about the audio?
Yeah, just play the audio.
Okay.
I have worked for Walmart for almost 12. I have worked for Walmart for almost 12.
Oh no, it's okay.
Oh, I'm sorry.
It's okay. So HIP supported these workers and our campaign. It was a multi-year effort, you know, and we did manage to get some concessions from the company during this time, but in April of 2021, we were in the middle of a drive with Walmart shareholders to try to convince them that the company was not responding adequately to the COVID pandemic and that they needed an advisory body of hourly associates who would be directing the company's policies and protocols during this crisis. And so HIP actually released 2 reports leading up to that vote. The first was a report about the public health benefits of real paid sick leave during the pandemic. And so I say that because Walmart doesn't have paid sick leave. They have these tiers of paid time off, they call protected time off and temporarily protected time off. If you're a part-time worker, you accrue at a much slower rate. If you're a full-time worker, it's a very still slow accrual, but it's a little faster. But it's not actually meant for sick leave. And so you still have to go through this very bureaucratic third-party vendor process to utilize your paid time off. And there are instances where workers during the pandemic were attempting to utilize this leave and took the time off because they got sick and then were told by the third-party vendor that that actually wasn't approved. They would get points. At Walmart, they still have a very antiquated point disciplinary system. 5 points and you're fired. It doesn't matter what the points are for. So workers were seeing themselves getting pointed out, fired, for taking sick leave that was actually theirs. In the middle, about year 2 of the pandemic, Walmart made a lot of PR news about giving associates COVID leave. That COVID leave did not cover children. Remember, schools were closed? Yeah, they didn't care about that. You couldn't utilize it for anything related to your child. And so again, it was just not a flexible, like, usable benefit for workers. And so we were demanding real sick leave that a worker could take without having to go through the third-party vendor. This report, actually, we sent it far and wide to press, to shareholders. There was a group of Walmart shareholders that were so riled up by this report that I had to ask Lily to meet with them. They're a religious group of shareholders. So there's a group of religious shareholders that own in a lot of companies, tobacco being one of them. They do it so that they can advocate. And they've held the Walmart stock for a long time. They tended to default over the last decade to really trusting anything the company said to them without talking to workers, for instance. And so we kept telling them, like, this is not how it's working in reality. And so Lily graciously came and met with the nuns, and I would say questioned her, but it was pretty, like, it was like a grilling. And, you know, but after that, thank you, because you didn't have to do that. But after that conversation, we really saw our relationship with that group of investors shift. And so they really did not only just appreciate Lily taking the time to explain the methodology and the findings, but they saw HIP as a third-party validator separate from United for Respect, separate from workers, because they considered us sort of not impartial. But they did consider HIP impartial. And my relationship to this day with that group of shareholders has really shifted. And so I always credit Lily's getting grilled for that. The next slide. And the other thing about this report this is like a nerding out on shareholder engagement, is there are 2 major proxy service advisors in the US, so they sort of will recommend a yes or a no vote on shareholder resolutions every year. There's a certain percentage of companies that just vote the recommendation, it's about 10%. They recommended a vote yes on a shareholder proposal one of our leaders filed this year, calling for a pandemic advisory council, and in their recommendation, they cited the HIP report. And so again, just further validation of how much they were giving credit to the research. The other report that HIP did for us was this on the benefits of the $5 increase, sort of the positive health benefits. And we were able to get news coverage of that. You can go to the next slide. HIP staff made themselves available to the reporters to answer questions, and we were able to really amplify the findings of this, in a moment where we were trying to win increases for workers. And so if you go to the next slide. And so, just to sort of close the loop on how we think about our partnership with organizations like HIP, it's, they're part of our theory of change. They helped us shift the narrative about paid leave and wages. They helped build what I call an intersectional movement infrastructure. Because I think it was an interesting conversation with our board and our members when I said I wanted to partner with this public health organization, because we were squarely sort of labor movement. And so I call it intersectional movement infrastructure, and I think that's, we need more and more of that. The silos are hurting us and our fights against corporate power. And then obviously corporate accountability. I mean, Lily directly spoke to a key stakeholder of Walmart and really helped change the relationship there. Thank you.
Hi everyone, I'm Suk. I am the research project director at HIP. I work with Lily. Also had the pleasure of working with Bianca, and then more recently worked on a project with Larry and Tony. So my part of the presentation is really about what does corporate power look like in the housing context. And I'll be focusing specifically on a research project that we carried out in this past year. So before we get started, I'd like for us to take a second and recognize where we are in our housing system and how it came to be. So in the U.S.'s housing system, where housing is treated as a commodity for profit and not the basic human need it is, we ask you to join us in recognizing Black, Indigenous, and people of color communities long before us and with us today, whose land and labor have been exploited to fuel selective wealth and create inequity and injustice in our access to home and health. So over the course of the presentation, I'll start with a background in terms of how this research came to be, including some background on commodified housing. I know when I started researching strictly as a public health researcher, this was new to me, and really shed a lot of light into why is our housing system commodified in ways it is, and how has government and corporate actors, how have they shaped it into the way it is. I'll talk about our methods that we used in the research and our findings. They follow a framework of 6 strategies that corporate landlords use to prioritize profit and harm health. I might not have time for our conclusion, but just to say that with the research report, there is an accompanying action agenda, and my colleagues will also cover actions that they're taking in their separate sectors, and our report is focused on actions that local government and public health could take. So this report is based off of a lot of input and guidance from housing justice organizers as well as public health experts who are telling us that corporate landlords is a problem. That's something that we're trying to focus on our campaigns. We largely carry this in strategic partnership with Right to the City, and Tony's from Right to the City. And in addition to that guidance, we also created or convened an advisory of 12 people from around the country, public health folks, as well as housing justice folks, who gave us feedback on the report, who guided us towards resources, helped facilitate stories that we can gather from residents as well. So the purpose of this report is multifold, as our research is, and Bianca pointed to a couple of ways that HIP research gets used. Part of it is we wanted to build a case for public health action and intervention and broadly governmental action and intervention in taking down corporate landlords. But also organizers and movements can use this as a resource when they're talking to policymakers. They can use this as a way to inform and educate their members as well. Okay. So the main research question that we were trying to answer was, are corporate landlords really worse? I mean, we knew, but we need research, right? So we were looking to explore what is the impact that corporate landlords have on health. And so we conducted a comprehensive lit review of media investigations, of peer-reviewed published academic literature. We also interviewed residents in St. Louis, in Los Angeles, and Colorado as well. In those same geographies, we looked at housing code violation data, and to look at kind of a broader scale or scope of corporate landlords, how many of them are there? We looked at the U.S. Rental Housing Finance Survey. So the U.S. has a long history of commodifying housing and land. So commodification really means converting something that is a good into something that is monetarily based. And so a lot of that has happened through essentially the history of the United States, through colonization, land theft, slavery, racist and predatory housing policies. The financialization of housing is one step further. It's an advanced form of commodification, and that's really treating housing as an investment vehicle. So really gambling on housing. And so in the past century or so, Congress, as well as other forms of government, have created financial tools for corporate landlords to thrive. So those include things like real estate investment trusts, LLCs, and generally neoliberal economic policies. In the last, I would say probably 30, 40 years, speculation and predatory investment practices have really taken off, starting by buying up multifamily housing, leading to gentrification and displacement of communities, especially in urban areas. And then since the financial or the foreclosure crisis, when banks were handing out faulty mortgage loans, a lot of BIPOC families and communities were left without a home, and also at that time was kind of a new wave of private equity investing in single family homes and really taking over. So how we describe or define corporate landlords is really around the structures that they use. So the U.S. Census Bureau's Rental Housing Finance Survey categorizes landlords into a couple of different categories. And so the one that we focused on is landlords who utilize corporate or investor structures such as those listed. And as of this last survey, about 45% of rental housing is owned by corporate or investor models. So looking back over time, the trend of their ownership has been increasing. Next month, the 2024 results will be out, and we have a good hunch that their stake is going to be even higher than it has been in prior years from other sources of data. So where do corporate landlords take over? They seem to hone in and expand in communities that are primarily BIPOC. They invest in all types of housing and single-family homes, multi-family housing, manufactured home communities as well. In just 2022, investors bought up nearly 30% of all homes for sale in the U.S. And both Lily and Bianca have mentioned private equity, and so I just wanted to repeat, in the way that we talk about private equity in this report, is that we consider them a special class of landlords, of corporate landlords, And just to kind of repeat, they will come in and restructure companies and resell them, often being around for only a short period of time. Their primary interest is to expand as much profit as they can to their investors in a short period of time. And so private equity is investing in and profiting not only from housing, but as other folks have mentioned, but from other aspects of our social determinants that impact our health. So healthcare, employment, infrastructure, fossil fuel, et cetera. So based on the stories that we learned about, the data that we collected, the literature as well, the way that we framed our report was through 6 strategies that corporate landlords use to prioritize profit and to harm health. And so the answer to that question of are they worse is yes, they are worse. Yes, but you knew that. So these 6 strategies that they utilize are often applied together. It's not like, oh, we're going to pick this one strategy. They often apply all because their main motivation is to seek profit from tenants. And when they do that, it creates a lot of suffering and despair for tenants through their health. And so I'll talk about that in a minute. One thing I didn't get to do in this presentation is to highlight a lot of the stories. So I hope you can check out the report to check out the stories. So in our first strategy, corporate landlords neglect upkeep. So they forego maintenance and investment in housing units. And so research shows that corporate landlords do commit a disproportionately greater number of housing code violations, more than smaller landlords do. And these housing code violations are linked and connected to poor health outcomes in communities. So there is some research that shows that housing code violations is directly linked with asthma outcomes in children in local communities. They also file for eviction aggressively, so they engage in this practice called serial eviction filing, which is evicting the same family or threatening to evict the same family or household over and over. They do this through their automated system, so even if people are like 1 minute late on their rent, they will file for eviction. Of course, they file for eviction at greater rates than smaller landlords do. During the height of the pandemic, they filed disproportionately against Black tenants. And we know from tons of public health research, especially through the course of the pandemic, that eviction is linked to horrible health outcomes. Corporate landlords also hike up rent, and they do so continuously, including during the pandemic. Lily referenced the lawsuit that happened earlier this year with the Justice Department suing RealPage, which is the company that works with corporate landlords to set rent costs. And so again, similar to the other strategies, they also are disproportionately more likely to raise rent. As a result of this, in addition to other fees that they impose on tenants, residents are left to sacrifice other basic needs such as medicine, healthcare, transportation, groceries, and that leads to anxiety and stress and other poor health. And generally, we know that rent cost burden creates poor health for people. In the fourth strategy, corporate landlords evade taxes, and the way they do that is because they have legal teams and the resources and the means to be able to fight property taxes, to avoid building fees, and research also shows that they're more likely to be delinquent on property taxes than smaller landlords. So when you think about the consequence of that, it's really that they're not paying their fair share of taxes. And what happens is that takes away funding that's important for public health, public education, and other public goods. They also dodge accountability, and that's because they're utilizing an LLC structure, oftentimes hundreds and thousands of different LLCs for different properties. And so it makes it hard for government agencies to track them down and hold them accountable to addressing the housing hazards that they're causing. And so what happens as a result of that is that the poor housing conditions and health conditions that people are experiencing, they just persist and go on for a longer period of time. And then finally, corporate landlords utilize their power and their influence to undermine democracy. They are able to sway political candidates into to pass and promote policies that favor them. They're able to fight against campaigns that are for tenant protections. And so far we've talked a lot about, or I've mentioned a lot about, how corporate landlords directly affect the tenant through their practices. But we know at a broader political level, which Lily and Bianca have referenced, that they're also able to create systemic conditions for tenants. Okay. I want to save time for our next two speakers, so I'm going to be super quick with this part. So as I mentioned, we have a set of actions that accompany the report, a separate report on actions. And these actions are specifically targeted at what government agencies can do. For example, increasing ownership transparency so we know who these landlords are, ensuring that residents have protections, resourcing code enforcement, having comprehensive protections for tenants, including centering tenant leadership, addressing root causes by taxing investors, and then importantly, resourcing public options that are permanently affordable and also community controlled. And I'll leave this here and I can bring it up at the end if folks want to get in contact. And I'll pass it over to Larry.
Let's see, Lily, you mentioned the democracy panel. I also was part or witness to the panel on public health professionals need to message misinformation and disinformation. A great panel. And I think this discussion that I'm going to have with you is about the other kind of information, that being public health professionals providing no information or not putting the information in the hands of the right people. But before I do that, I'm going to figure out how to advance slides. So do I just hit this button? That little arrow right there.
Yeah, tiny.
Okay, great. Then first, I want to express my appreciation to the American Public Health Association for allowing me and my colleagues to be here speaking to you on this really life-threatening issue. But first, I would like to introduce myself to you. Quick summary. Larry Brooks, African-American male with some French, Irish, and Chinese ancestry. I go by he, him. I began my career in the hospital thinking I was going to become a physical therapist. Through an act of fate, I ended up leaving LA and going to Sacramento and going into environmental health, where I eventually found myself going into various code enforcement programs. So, speaking of code enforcement, this picture here kind of describes some of the things, kind of a simplified overview of what many, quote, housing or building code enforcement officers are dealing with in regard to violations of healthy housing principles by corporate landlords. This picture was taken years ago before public health kind of educated us code enforcement officers to the importance of PPE when going into moldy buildings. So now when I teach officer safety courses and I get to the part about mold, sometimes to wake up the crowd, I'll say, that's why I win, because when I smell mold, I say everybody's mask goes up. And thank you. And I get a few laughs, and if my grandchildren knew I was doing that, they'd be shocked and ashamed and embarrassed. But I do it to make a point. Which brings me to the first point I want to make with you all, which is illustrated by this plot map showing the location of substandard complaints in Oakland, California. The point being, code enforcement organizations typically track where the substandard housing complaints are located. As one code enforcement officer said to the Deputy Director of HUD Office of Lead Hazard Control and Healthy Housing at last year's Lead and Healthy Housing Conference, he said, "We know where the bodies are buried," meaning housing in need of repair. "Why don't you provide grants to support housing code enforcement proactively inspecting them so you can then use your lead paint remediation and healthy housing grants to fix them?" Great question. If we have time for question and answer, I'll tell you what response he got from HUD. But this ties into the second point, is that many public health organizations will collect data for the purpose of predictive hotspot mapping, as illustrated here in this slide by Alameda County's Public Health Department Community Assessment Planning Evaluation, also known as the CAPE unit, where they have used various data sets such as age of housing to predict where people are at most risk of illness related to lack of home repairs. And that ties into my third point, illustrated by these photos of code officers at work inspecting properties being used for human habitation. The point being that code enforcement officers need your help, public health professionals, if we are to protect those who we have sworn to keep safe in healthy homes. So any code enforcement officer, be it a housing, zoning, vehicle, fire, animal control officer, et cetera, will tell you that when a complaint is received, within the first bundle of tasks for that code enforcement officer to perform is to locate the responsible party. Not necessarily to write them a citation, but to make them aware of an alleged violation. So as you can see in this slide, from my quick polling over the summer to gain support for a state bill that unfortunately was defeated in the legislature, corporate landlords are a big problem for us, as emphasized by the comment seen here that was made by one of the code enforcement officers completing my Google form, where she or he said, anything that can help us find out who is hiding behind these LLCs, LLPs, and trusts would be helpful. Anything, that's a pretty desperate word, isn't it? Anything. Because as the poll shows, 98% of those responding support a bill to make corporations and LLCs more transparent, because I can tell you from experience, it is often a real pain to identify a contact person for a corporate-owned property. And that's further illustrated by this slide. I like to point out in this slide that the pie chart has no blue in it. In other words, none of my sister and brother code enforcement officers could say that they, quote, never have challenges reaching a responsible party when locating the property owner, also known as the corporate landlord. Again, there is a comment in this slide I took from one of those taking the survey, and just basically it's saying that, again, anything, we really need help in order to identify these LLCs, because people hide behind the LLCs and refuse to take responsibilities for blighted properties that impact the health of the residents. So compound the code enforcement officer's problem of not being able to locate or communicate with the representative of rental property owned by a corporation, along with the fact that many tenants are afraid to even report a complaint out of fear of eviction, deportation, or worse. Years ago, I had an environmental health specialist in San Francisco tell me about walking into an apartment complex and turning a corner and nearly crashing into a property manager who was beating up a tenant for complaining about substandard conditions. I would like to think that that could not happen in 2024, but I imagine it might. So again, I say we have an exasperating challenge for code officers trying to correct health and housing conditions in rental properties, particularly those owned by corporate entities, because as the table in this slide shows from this report, it points out a significant number of tenants fear evictions and also being priced out of their homes. So have you ever heard the poem, "How Do I Love Thee? Let Me Count the Ways"? Well, this is a tragic twist on that poem. An article came out in Oakland 2 weeks ago. It was produced through the Pulitzer Prize Project. And as I read through it, I thought, how many ways can I lead poison both a mom who now has kidney failure and her daughter who now shows signs of learning disabilities after exposure to lead while in her mother's womb? Let me count the ways. Sanding paint without HEPA-vax, blow-torching paint off window frames, leaf-blowing paint debris into storm drains, power washing without containment, sending wastewater into storm drains, lead pipes and lead faucets, lead soil contamination. I could go on. I tell the story in our paper submitted to the American Public Health Association about the twins that my staff rushed to the hospital for chelation after exposure to lead paint flakes and dust, and how challenging it was to reach the corporate landlords. This is a growing trend, and we need the public health community working in partnership with code enforcement and school districts to reverse this trend. So, how can you help me make the case for a comprehensive approach to making and keeping rental housing healthy through strategies such as routine inspections and tenant protections in general, but specifically for addressing the challenges described by me and my colleagues here regarding corporate landlords? I turned to my code enforcement rock stars in the city of Rochester, New York, who created a proactive rental inspection program that includes testing for lead paint hazards such as paint, dust, and chipping paint. And here you have a slide that they sent to me that showed their activities over a 10-year period inspecting for code violations as well as testing for lead hazards. And as I speak about those Rochester rock stars, I also turn to those other rock stars that I equally admire in Monroe County Public Health, who is shown in this slide that was sent to me by my code enforcement officers in Rochester. They track the impact of those rental inspections on child lead poisoning rates, where there appears to be a clear correlation between proactive inspections and lead testing and a reduction in child lead poisoning. Similar findings were observed from the Baltimore variation of proactive inspections for lead hazards, thus providing some of the evidence that I use to promote proactive rental inspections wherever I happen to speak. A couple of other examples of successful advocacy through shared health and code enforcement data is demonstrated in these two documents I took part in creating. The Housing Habitability and Health publication was a joint effort by my department, the Healthy Homes Department, and the Alameda Public Health Department. And the Oakland Race Equity Impact Analysis publication was done by a consultant hired by the city who utilized data collected from our department, our public health department, as well as state public health agencies. It is through expansion of examples like these of public health organizations collecting data in partnership with code enforcement and healthy housing organizations that we can then provide the efficacy arguments for implementing strategies to address corporate power that is making home occupants sick and in some cases actually killing them. Time does not permit me to go over all the legislative accomplishments of the California Healthy Housing Coalition in partnership with the California Association of Code Enforcement Officers, but I'd like to point out two of the latest. Assembly Bill 209, also known as the 2022 Extreme Heat Code Law, requires the California Department of Housing and Community Development to develop policy recommendations to ensure that residential dwelling units can maintain a recommended maximum safe indoor air temperature. And then there's, the Ghost Ship Bill, signed into law just last month. It specifies that a building be deemed a substandard building when a health officer determines that any of the conditions listed in the law exist to the extent that it endangers the life, limb, health, property, safety, or welfare of others. Now we can go to that slide. As I close, got a couple of minutes, good. I want to share with you all that after 40 years of government service, I will be retiring in February 2025. And so again, I want to thank the American Public Health Association for this wonderful opportunity to speak at this prestigious conference before closing out my career as Director of Alameda County Healthy Homes Department and Child Lead Poisoning Prevention. However, I'm not quite ready to sit down, so I am starting a new career, not as my character in a recently released children's book on lead poisoning prevention, nor as my health, education, social media character, Healthy Homie D-Clown, but as a consultant. That's right, a healthy houser for hire. If you read the Luke Cage comic books or watched them on Marvel TV, then you kind of know where I'm coming from when I say healthy houser for hire. And so, in closing, given this is Rockstar Purple Prince Day, and as you can see there, I do occasionally pretend to be a rock star. I leave you with these Prince lyrics. Oh baby, nothing can stop us now, because I'm going to show you how. Show you how to work. And given we have work to do in order to address the corporate landlord crisis, I now introduce to you Tony Samara, who will show you how. Thank you for listening. God bless you all.
All right, that's quite a setup. And one of the downsides of going last in a panel like this is there's that much more to say, but hopefully I can contribute something. Hi everyone, so I'm Tony Samara. I'm the Associate Director of Political Strategy at the Right to the City Alliance. I've been on staff there for about 3 years. Prior to that, I worked for almost 8 years in the tenant movement in the Bay Area of California and across the state. And prior to that, I spent a decade as a professor of sociology, and my work was in urban development. So I've been involved for a bit. So let me say a little bit about Right to the City. Next slide, please. We are currently about 70 member organizations around the country, I think in about 25 or 26 states, many cities. The vast majority of our members are tenant organizing organizations. They mobilize tenants in buildings, in neighborhoods, in manufactured home parks. And then we have an increasing number of organizations that are working on decommodification campaigns, so taking land out of the housing market. And there are a lot of different ways that they're doing that through tenant opportunity to purchase campaigns, social housing campaigns, limited equity co-ops, and again, manufactured home parks buying the parks that their units are in. Most of our fights are at the local and state level. We do a little bit of federal work, but it's primarily because we are a community organizing alliance. Our policy fights tend to be local and increasingly statewide, and in part because for a lot of the things that we fight for, like tenant protections, many states have state-level preemptions. So for example, you can't pass rent control at the local level because the state prevents that, so you have to actually change state law. Again, so the overriding kind of principle or value that we organize around is this attempt to move land and housing out of the for-profit market and into permanent, affordable community control. That's kind of like a unifying thread. And public health has been a really important part of how we approach this work. And at Right to the City, we've been lucky enough, as Seth talked about, to partner with HIP now for a number of years across a range of projects, many of which are ongoing. Prior to coming to Right to the City, when I was working in the Bay and in California, we did a lot of work with public health agencies. They were a really critical part of the campaigns that we had launched and that we fought. We did everything from community workshops together to kind of strategizing around how we approach city councils, developing messaging, right? There's a range of ways that we work together. But so through that, both through the organizing and through working with health partners, I became really familiar with the negative health impacts of unstable, unaffordable housing and the benefits of partnering with public health allies who understood this relationship. And in terms of the health impacts, the basic relationship we identified is between housing stability, housing quality, and health. Unfortunately, in the private housing market, renters rarely have either stability or quality. And I'm referring primarily to lower income working class renters, and especially renters in communities of color where housing burdens are disproportionately concentrated. So you see some of the health impacts that we deal with, and I'll talk about each of these a little bit. So here's what we see in the work that we do. First, there are the kind of the more well-known conditions, some of which Larry spoke to. Habitability issues, mold, infestations, poor heating and cooling, appliances that don't work, kind of the daily grind of poor living conditions that people have to contend with. And there are the obvious health impacts, the physical health impacts of these conditions, but there are also mental and emotional impacts of these conditions as well. The stress of not being able to have your kids in a warm place in the winter or a cool place in severe heat, for example. Then there's the stress of potential eviction, living with that hanging over your head day after day, and the toll that takes. And the coping mechanisms to deal with that stress, to try to reduce that kind of vulnerability, double or triple up. You have 2 or 3 families in a single apartment as a way of addressing things like increasing rents. But that, of course, creates a different kind of vulnerability because now you're in violation of your lease, which means you're less likely to even want to have health inspectors come in because you don't want them to see that you're doubled or tripled up. So kind of trading one kind of vulnerability for another and living with that again day to day. Then there's the eviction itself. Again, coming from the Bay, the last decade has been pretty brutal in terms of the eviction crisis. So not only the impacts of habitability and the stress of evictions, but literally mass evictions. In my neighborhood alone, I live just south of San Francisco, about 20 minutes, in a neighborhood that are in between 2014 and 2018 saw entire blocks, one after another, get emptied out of working class people of color as speculators came in and bought up buildings. And in addition then to this, again, the stress, the fear of eviction, once the evictions happen, you may not be able to find another place to live in the neighborhood that you were evicted from, where your support systems are, where you know the neighbors, where your kids go to school, where their friends are. We saw so many people, families evicted in the middle of the school year, so kids have to pick up in the middle of the school year and move often to a different district, and sometimes multiple times in a single school year. And that, of course, we know the long-term impacts of disrupted education. That kind of carries with you throughout the course of your life. We saw that every single day in the work that we do. We see that every single day. The reasons are not hard to understand, some of which were touched on in the previous presentations. But, you know, I like to make things simple. That helps me. Landlords make more money when they when they maximize their revenue, which is rents, and when they minimize their costs, maintenance, services, and so on. Like, that's fairly straightforward. It's kind of the simple mathematics of renting to vulnerable populations who don't have a lot of options. And on the one hand, we can and we should hold individual landlords accountable, right? We absolutely need to do that. On the other, we need to recognize that this is a systemic problem, not a problem of a few bad apples. And this is why, you know, to come directly to the topic of corporate landlords, why the increasing presence of corporate landlords and of hedge funds and private equity in particular is so significant. They represent an incredible scaling up, kind of an industrialization and then a financialization of the extractive rental economy. It becomes more extractive, more efficient, and more brutal. And in some ways, this aspect is more important than always focusing on the difference between smaller and bigger landlords. The issue is really one of scale, taking bad conditions that are built in systemically and scaling those up and packaging up these rental units, single-family homes into investment vehicles. The other way that scale matters is in terms of accountability. The tenant movement spends an enormous amount of time just trying to figure out who owns a building or who owns a single-family home, the amount of resources that we put into that. And we've been lucky enough now as the movement matures to develop really good partnerships with public health, with other kinds of researchers that help us do that research and figure out who actually owns this building. So for me, it's natural and obvious that corporate penetration of the rental market is a public health issue, a massive public health issue. Housing is about as fundamental a public health issue as there can be. Going back to the Victorian era, we know that public health and housing issues have been linked. Quality, stable housing probably does more for a person's health and for community health than almost anything else. So this, the question that we came to in our work was how then do we integrate public health into the housing justice movement? What does that look like? And I think we've got a fair amount of experience both at Right to the City, but also more broadly in the housing justice movement. A lot of good lessons learned. I think the first thing to I guess point out is that our primary approach to building power is community organizing. Right? We put our faith in the ability of people most impacted to advocate and make changes if they're well organized, and that's where we come in to try to support that organizing. The idea that then they can identify, develop, and implement campaigns that are rooted in their conditions, whether those again are at the local level, at the state level, and potentially sometimes even federally, to support habitability, stability, and importantly, community control. We learned though that it's not a fight they can win on their own. They need allies, they need accomplices, so that they can increase their power. And in my experience, and again in the experience of the movement as a whole, I think public health agencies and public health organizations are really key here. You are trusted, you have skills that we need, you have access that tenants often don't have to elected officials, to media, to the public. To put it another way, you can extend our collective power into places that we can't always access, and you can open up new fronts in the fights that we're waging. Now, the better coordinated we are, the stronger we are. And that requires, and this is, kind of one of the big challenges, building trust. Building trust takes time. So a core component of building the relationships between public health, whether they're government agencies or nonprofits or other formations that work on health, we have to start sooner rather than later. I think I personally have seen and learned the hard way. If you try to build those relationships in the heat of a crisis or in the middle or at the beginning of a campaign, it's harder to do that because those are intense moments when weaknesses in the relationship become weaknesses of the movement. So it's really important to lay the foundations for the relationships early on, to kind of work out the challenges before the kind of trial by fire. Because there are always inevitable growing pains. Those can be worked out. I've seen them worked out. We have worked through many of those, and then we come out much stronger in the end. And a lot of the campaigns that I've worked on that were successful because we had strong trust with our allies. So one of the key things for public health allies and community partners in the housing justice movement to align around is, as I said at the outset, this end goal of moving as much land and housing out of the market as possible. This is the systemic change that's needed to move from a system that undermines stability and habitability to one that supports it. And having this kind of vision, this value, this goal is really clarifying and important because it allows us to build coalitions and alliances around these longer-term strategies, even as we're fighting in the short and immediate term. Strategy matters, and again, building alignment around strategy takes time and takes trust. It shapes how we approach the things we do in the moment, whether they're tenant fights, whether they're zoning fights, these kind of, again, in the moment fights, really change depending on what your longer term strategy is. And if you're unaligned around strategy, it really creates chaos in the moment of the immediate fights. So that becomes an important part of relationship building. It affects narrative and communications. It affects how you do community outreach, how you talk to elected officials. It even helps you figure out which campaigns to wage and which campaigns to pass on because you can't do them all. And importantly, again, it helps to build trust because it's ultimately these shared values and developing alignment around these values, around the kind of community that we want to live in and work in that puts these values into action. And I'll stop there. I know we're getting tight on time. Thank you.
Thank you so much. Maybe I'll stand. Yeah. So, sorry, let's do that louder. Everybody give it up for all. Thank you. Yes, I love the round of applause. I see you, round of applause. So we have about 15 minutes left for questions. I'm curious, do folks, anybody have a burning question? Okay, actually, let me get everybody to raise their hands who has a question. Wow, 1, 2, 3, 4, 5, 6, 7. Okay. Okay. What I'm going to do is take 3 at a time, okay? And then I think I'm going to invite, so listen closely. And I'm going to ask not everybody to respond to everything, but pick and choose. But if we could just kind of get 3 out at a time, I think it'll help us get a sense of if things are correlated. If I could have you go first, please.
Sure.
Yeah, and go ahead and introduce yourself too.
Yes. Hi, my name is Cassie Owens. I am from University of Iowa. I'm a second-year health administration and policy student in the master's program. And I am curious about corporations in healthcare, as I know we've covered a lot of the housing industry, retail industry,
Yep.
but in public health, of course, we are concerned about health administration and
Yep.
those organizations. So how do we address healthcare as for-profit entity, especially as it comes to private equity and partnering with corporations with like Amazon or Walmart?
Great.
Because that's happening.
Okay, great, thank you. So corporatization, financialization of the healthcare industry, how do we handle that? Okay, next question.
It's related. Sorry. Hi, everyone. I'm Yusra. I'm a PhD student at the University of Minnesota. I have a related question. Like, we're all sitting here with our United Health Foundation, whatever, and like that contradiction is just like in my mind right now. I also think about a lot of tenant organizations around the country, including the one that I organize with, rely on grants from foundations that are affiliated with like the same corporations that are creating our housing crisis. And so I'm just wondering how you all think about the contradictions that come up in our work. And yeah, it's like, I think it's really
Great, okay. I'm gonna take a third question. Yeah,
Thank you. My name is Elizabeth Gray Bain, and I'm a documentary filmmaker. I make public health documentaries. And this was a really refreshing conversation because I've been in public health for 15 years, and we haven't really addressed the corporate aspects. We keep making it an individual thing. And the private equity point that she brought up is not only in hospitals, because hospitals are closing because they don't make money. It's also affecting journalism, where they're buying, newspapers.
Yep.
They think it's failing, but it's just because they're dismantling them. And so it's everything. And my actual question is, I'm in California, where we have homelessness. And I'm not an expert the way you all, but I suspect that the idea of developing more affordable housing is propaganda that was based on lobbying from the development industry. How are you, because this is information that even people who work in homelessness, like they're saying, oh, we need to build more affordable housing, but they're not going to build affordable housing. Really the issue is commodification of housing. How, like, what are you doing to counter that? I'm just curious, like that's, over 10 years they've managed to get everyone to repeat that over and over again. And it's really about it being a public right.
thank you. Okay, I know there's a whole other batch of questions. I'll move to the back. Can I invite you all to speak to any of that for a couple of minutes, and then we can ask the audience to. So whoever wants to go first, I'm not going to call on you.
Well, I'll get up.
Okay.
I love Iowa because you guys require children to be blood lead tested before they enter kindergarten. I've been trying to get California to do that, at least in targeted neighborhoods of color with high childbed poisoning rates, and can't get it done.
Okay, Mike.
Oh, dang.
That's all right.
Okay. In regards to corporations and the move to build more affordable housing, and the housing ends up being more expensive oftentimes. I was at the East Bay Rental Housing Annual Rental Expo, where the landlords and all their lobbyists got together, and I got to be a fly on the wall. They are concerned that as you build more housing, even if it's more expensive, it forces them to drive down their rents. And you've probably seen all the commercials for Proposition 33 on TV in California, where Kamala Harris is giving her speech about if I'm elected, we're going to take on corporate landlords. And my thought on that is, if she is elected, we have to hold her accountable. Even if she's not elected, we have to hold the federal government accountable, because the Healthy Homes Department, we do use federal grants to do home modifications and to do lead paint remediation, but we don't have enough. And we certainly don't have enough money to pilot code enforcement, proactive rental inspection programs like that gentleman in Orlando, where he spoke to the deputy director of HUD and said, why don't you give us some money? We know where the bodies are buried. And the response was, well, we encourage all of our grantees to work with code enforcement. Well, encouraging money. And without money, you can't do a whole lot. And then, did anyone want, before I take up that all the time, did you
Yeah.
Thank you. So the affordable housing question, right? That's a big one. So I'm just going to try to give some top lines because it's something that even within the housing movement, there's not necessarily full alignment on. But I can tell you where we come from on that. And the big challenge with affordable housing as kind of a policy is that it's still market-based. Like, what can the market bear? So developers will go to cities and propose a project, and they'll say, this is as much of the affordable housing as we can afford, 10%, 8%. And the market incentives are to build at the higher end of the affordability scale. So like in the Bay, you can build affordable housing at 80 to 120% of area median income, which essentially freezes out anyone working class or low income, but the developer can say, we build affordable housing, right? So that's a huge issue. So we really want to talk about what do we mean by affordability, and developing real measures of affordability that target housing to very low income. The other bigger problem is the market's never going to provide adequate housing for that.
We need to change the narrative and stop saying it's about that, it's about decommodification.
Right, right. So, okay, and so on the solution side, and that's, this last slide here, so as I said, a lot of our members are moving into this model of building or acquiring land and turning it into decommodified housing, whether it's through land trusts or other kinds of nonprofit status. The big concern there is scale, right? I mean, it would take thousands of years to build affordable housing at scale through individual CLTs, community land trusts. So how do we address the scale question? Where we're coming down now is on social housing. If you're not familiar, social housing refers to government-built housing across income levels. So to the extent that it differs from what we typically think of as public housing, it doesn't just target very low income. And there are countries in the world that have done this, and people travel and check it out, Singapore, Austria, other places. But the big problem it's meant to address is the scale problem. It could happen at the federal level, certainly, although let's not hold our breath. It could also happen at the state level. Like, I live in California, the 5th largest economy in the world. Don't tell me we can't build social housing if we want to. It's a political question, not an economic question. And I don't want to suggest it's the only way to address the scale challenge, but it's certainly where there's a lot of momentum developing to address scale and the questions of affordability that you raised in your question.
Bianca, I wonder, do you have anything to offer on the how do you manage the contradictions question, or?
I mean, the only thought I have, I was actually recently at a conference where a whistleblower from United Healthcare, he was the person who for almost 2 decades went after patients and their families who tried to appeal denials of life-saving, expensive procedures and surgeries and medications. In one case in particular, got him to whistleblow and leave the company. So a couple of things that he said, and I would argue that there's some small tweaks that he suggested that we should do that are still probably huge and hard, which is decoupling some of the segments of the business. So United Healthcare also runs the pharmaceutical line. And so they are setting prices, and then they're dictating to doctors what medications to prescribe at what dosage and what interval. I mean, that stuff just needs to get separated. There's such an incentive for them to skim there. But I mean, structurally, what we need is to use their term, like to decommodify healthcare. I mean, people should not have to be dependent on employers to provide healthcare. Most employers are providing, this is my friend, shitty healthcare. With very high premiums, not a lot of coverage. I mean, that's just like, they're working full time, and it's horrible. We need something different. I'm a huge proponent of Medicare for all. I think that, but I mean, again, federal government, like, we're not going to see it happen soon. So.
Did you want to offer? Okay. Let me, I'm going to take 3 questions. There was this crew in the back who had raised their hands. So I see 2 of you back there, black glasses. Both of you have black glasses. And then I'll do Anna up here. Go ahead.
That workers are put in to live, child labor, all of this. When we've taken this to our legislature, we finally prevailed and got it for services funding. We kept hearing public safety issues, labor issues, even though we really have our trafficking responsibilities for public health in our state.
Thank you. Yep.
I'm John Burke. I'm the Indianapolis Public Health Department. Yesterday, I attended a panel on threats to democracy, and 3 public health experts nationwide came to the conclusion that the only thing we can do is vote. And I guess I'm tired of path-liberal solutions. How do we educate our colleagues on unionism, how to educate them on collective action? I'm just sick of the idea of
Yeah. Okay, I'm gonna take moderator's prerogative and say I was shocked that none of them talked about organizing. Like it was, and I deeply respect some of them, you know, and there was no discussion. Sorry. Anna. Can you introduce yourself?
Yeah.
Sorry.
Ana Gallego with the Robert Wood Johnson Foundation. But I used to work for a health department that was part of it was a cabinet agency, and then another part, so we reported to the mayor, and then the mayor was also responsible for the public housing, which was horribly deteriorated. So I wonder if you can speak a bit about how can government and public health agencies support the housing movement when they would probably be precluded from being able to speak about public or social housing because of the budget implications for the elected official labor force.
Yeah. Who would like to? Do you want to talk? To me, I'm like, you know, inside outside strategy. Take it away. We have about 3 minutes left.
I think to your question, you know,
And also,
I often think that we just take too a fragmented approach to the challenge of poverty. I mean, our economic system is one in which it sort of necessitates an underclass, and we have to sort of reckon with that and be honest about it. And when you're a poor person in the U.S., it's because of your wages, and then you have the housing issue, you have the public education issue. Walmart and Amazon both have healthcare business segments that are growing and profitable. Walmart is very, very clear about this, and they say, we have the scale where in every community in the country, rural, suburban, and urban, we can put a clinic. It can be a horrible medical clinic, but we will have the patient population to make money. You know, the pharmacists are, if you look at even, they've been operating pharmacies and optometry clinics for decades. Those people make well below market rate for their fields when you work for Walmart. There's a reason they're doing it. They're commodifying anything they can. And with a company like Walmart, they actually have the retail footprint to do it, you know, to really operationalize some of this. But I honestly think we just have to take a different view of what does it mean to be poor in the U.S. Because it's not just about work, it's not just about housing, it's compounded, right? Like this is your reality, and I think no matter where you sit, you know, like whether you're a labor activist or a public health practitioner, like we have to have that similar view. Because otherwise you individualize a problem that isn't an individual problem.
Okay.
I like you stand up every time.
Okay. Yeah, we can do more than just vote. We can organize. As I mentioned in the slides, the California Healthy Housing Coalition is made up of a diverse group of public health professionals, code enforcement, tenants' rights groups, et cetera, et cetera. We don't have to wait for a ghost ship tragedy, although it was the ghost ship tragedy that kind of helped bring us together to get that law passed. It was also the tragedy in San Mateo with the farm workers who were living in cargo containers that helped to drive that. But that's why I say, you guys have so much data, don't keep it amongst yourselves, share it with those types of coalitions, because as my political consultant said, first priority of a politician is to get elected. What's his second priority? To get reelected. And if we can educate our community and educate, you know, our regulators, then we can build the political will and we can get things like the Ghost Ship Bill passed.
Did you have a closing?
It's not a closing. It's not super inspirational. I think as a researcher working with community organizers and being the link between health departments and organizers often is that what I see is so many barriers around public health and public health departments and trying to get involved. The data is huge.
I mean, in every research project we work on, it takes forever to get data. If any, it's in the wrong format, it's unhelpful. So I think there's got to be some work done inside about how can you make yourself take initiative and be proactively supportive of campaigns that organizers are running in your communities.
I think on the democracy question, so this is something that we've been wrestling with for years. Most of our members come from communities that have been burned by the electoral system for decades, if not longer, and in different ways became disengaged. And now we've created a seat for it right to the city and are engaged in electoral work. The big question is not whether or not to be involved in electoral work. The question is how do you integrate electoral work and organizing in ways that magnify the power of both and don't fall into the trap of putting all of the energy into get out the vote and kind of election season stuff, because it's relentless. I mean, I can see how it is very easy, even if you say we're going to do organizing and electoral work, the demands of electoral work are such that it's very easy to get pulled into that orbit and not be able to leave. And so that's one of the challenges I think we, as well as others across the kind of social movement left, are really contending with, because it's obviously clear that one way or another we have to engage with the electoral system. We see what happens when there is no left force in the country. We are where we are.
Thank you. If I could get one last round. Thank you, everybody. Come on up. Thank you. Come on up. Feel free to ask your questions. I'm sorry if I didn't get to